Hi everyone, welcome back. Yes, I'm back at Ritaka's. This is my home away from home. There's a way to get the skin to look the way it is at 55. So today, as a couple months ago, I did my chest for sun damage. And you can see that I have still a lot of sun damage. It's called baby oil when you lay out in the sun in the 80s. So what I'm gonna do right now is I'm going to be doing my face. I have some sun damage. I do this about maybe twice a year just to keep the sun damage at bay. So right now I am with Taylor, and Taylor's gonna wash my face and get me ready for Jen. So here we go. All right. Hi Taylor, say hi.
Hi.
So yeah, we are gonna do this again. You need to keep up on doing this stuff. It's not something that you just don't do and it's over. So, and I wanted to show you guys because this is the very first video I ever did, which I did such a crappy job on. So I figured I'd show you guys really how this is supposed to work. And if you have any questions, please feel free to leave them below and I will answer any questions you have. And as usual, Jen will also be available. I think it's jen.greco@ritaka.com, I think. Jen, it's just Jen Greco. Oh, okay. It's jen@Ritaka Laser Center, okay, .com. So here we go. Clarisonic time. I came in with only my sunscreen. So right now though, the skin has to be perfectly clean. And we got to get that sunscreen off. So anyway, I will let Taylor here clean my face and I'll be right back. Okay, so Jen is in here. And what are you going to do to me?
We are going to perform a Forever Young BBL Photofacial.
Yay! And what did you say you're going to do? You're going to blast my face?
We're going to blast Linda's face.
Yes, we're going to blast Linda's face.
Because I love her.
Yeah. Wait till you see how she does. So I'm going to show you guys what she actually does for the first pass. How many passes do you normally do?
4 to 6.
4 to 6, and
Yeah.
then do you increase the frequency while you're doing this at all, or no? Or you keep it pretty
different filters.
Different
so we're going to do different wavelengths.
Okay.
Because I know we've been doing this for how long now? 6 years
God,
now.
at least, yeah.
Your levels are up there, and there's really no room to go up. I treat you the most aggressive I can.
That's why I'm going to be really jacked up for the next 3 days. But that's okay. The results are so totally worth it. Now, Jen, my big concern here is if you notice here, this is where see the redness right there? Mm-hmm. This is where the redness, it's not on this side.
Yeah.
Not so much on this side as this side.
Do you know why it's on this side?
Right, because of the left, because you drive in your window. So I need you really to get that redness, try to zap that redness.
Okay.
So here we go, people.
All right, so we're going to do some full passes first, and then
Okay.
when we do the spot work, I'll pay some extra attention over there.
Please, thank you.
Absolutely.
All right.
We're going to go back, and then I'll goggle you.
Okay. Here we go, folks.
Do you have enough light in here, Linda?
Yes, I do. I prefer natural light. That way people don't get that filtered look. You know, when people filter themselves to
You want to hold that with the other hand?
Yes.
Is that the ring light that the YouTubers look?
Yes.
That make them look a little filtered?
Yes. Which is great to shoot videos in a room but natural light is always better.
Yeah.
So at least because you get to see all the reality of life. We are not all perfect as Instagram or YouTube would like you to think we are. So.
I watched your video on the Huda palette. I was planning on going to get it today after work.
Absolutely the best purples in the galaxy.
I'm excited.
You should be excited because it's actually really good. I was looking to maybe go pick up the red one, the ruby, because that looked really good too. And she has the topaz, which is basically the browns and the golds. But we have so many palettes, so many warm palettes.
I know.
That I don't really,
See, I can't do the reds. I just can't. I look like I got pink eye and I'm sick. I try.
Yeah, see, you won't get that with the purple.
Yeah.
Because the purples are really good purples. So, okay, so what are you putting on me?
This is just ultrasound gel.
Okay.
It's just going to help keep your skin cool through the treatment.
Yep. Okay. You hear her beep, 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 beep? That means she's going way up.
Here, let me show them what the laser looks like.
Okay, there you go.
Here's the laser. Ooh. Okay, we're going back to your hand.
Okay, look, I can't see people, so point it down to me.
You're right there.
Okay, so here we go, guys. We are ready to go. Oh, there you go.
So that's the light the laser gives off. And are you ready?
Yes.
1, 2, 3.
Okay, so let me explain what this feels like. It doesn't hurt, quote unquote hurt. And she has me on the highest setting, okay? What it feels like is a rubber band snapping you. You got a baby, like those, that's tender.
You okay?
Yeah. But it's like a rubber band snapping,
That's a perfect way to describe it.
right?
Yep. Rubber band snap.
And it, the first couple of passes, you're like, okay, that feels interesting. After that, it really does become almost routine. Oh,
You okay?
yeah. That one's run to the eye, that's why. That's a very tender area.
And once it's done, it's done. She's not going to feel any lingering pain
Right.
at all.
Right.
She's going to feel a little sunburn, but that's signs of a good treatment.
Yes.
And I would say like an hour or two she might feel that way.
Now, I may get swollen because she goes very aggressive on me. And honestly, I asked for her to go aggressive on me. You don't have to. And you still can get a good treatment. Because I've been doing it for 6 years, there is really no real brown spots on my skin, which is really what initially people try to do this for. But the sun damage is still there. It's just underlying. So eventually it comes back up. But I think we got the brown spots, don't you think, Jen?
Yeah. And another reason I recommend my patients to continue doing this, even if they don't have any browns, is this is the only thing on the planet that will actually change your gene expression. So what that means is when we're young, we got all these genes doing what they're supposed to be doing, and the skin is beautiful. And as we age, certain genes will turn off. And they did skin biopsies before and after this treatment, and what they found was certain genes that were turned back off were actually rejuvenated. So as corny as this sounds, it is the closest thing we have to the fountain of youth, and that's why it's probably my favorite treatment.
So let me ask you a question,
Yep.
because this is going to come up.
Okay.
How does this differ from an IPL?
So IPL is intense pulse light.
Okay, this
is broadband light.
Okay.
Bite the lips. IPL technology is a little older technology.
Right.
Where this is much more advanced.
Okay.
So this is kind of newer, better technology.
Yeah, because I've seen.
And you will not get that gene expression with an IPL.
Okay.
It's only been found with the broadband light.
Yeah, now it's because I have had IPLs and I didn't see the same results.
Ready? Mm-hmm. And I can tell you, I have a handful of patients that I've been seeing for, over 8 years. I think I've been playing with this laser.
So then if you've been playing 8 years, I've come here for 8 years.
Yeah. And I mean, I think you look better now than when I first met you.
Oh, absolutely.
Yeah, absolutely.
Oh, absolutely.
So, I mean, that's amazing.
So what
That's
does that
8 years
make me?
later.
That was what? I came here at 47. I'm now 55. Mm-hmm. So, to say that my skin looks better at 55 than it did at 47, that's a major accomplishment. So, and all you ladies out there that are, talked about my skin, I appreciate that compliment more than I appreciate anything else.
Yeah.
Because I really don't use a lot of foundation and things like that because you don't have to when you do stuff like this. You know what I mean?
And at a certain age, and tell me if you agree, I think the foundation tends to age a woman more than it
Absolutely.
complements their skin.
Absolutely. I would say that less is more when you get to a certain age. Mm-hmm. I would say that after I had turned 50, I actually did see that because foundation, and I don't know if you guys all watch Wayne Goss. If you don't, follow him.
Love him.
Love him, okay? If you listen to Wayne Goss, who's probably as far as I'm concerned, the premier makeup artist out there, he will come right out and say,
Yeah.
just foundation will add texture. Texture adds age.
Yep.
So I don't care how smooth your skin is, you put foundation on, you're putting a layer of something on your face that really doesn't belong there.
Yeah.
So now,
And just for a shout out for your young viewers.
yes,
You teenage girls, 20-year-olds, 30-year-olds, you do not need foundation.
Absolutely.
Get a good concealer to cover up the spots, what you don't like, and use a little mineral powder everywhere else.
Exactly.
I see so many young girls putting these masks on their face, and you don't need it. Let your true beauty shine.
Absolutely. Not only that, I always find that it ages them too.
Yeah.
Here's these 12-year-olds that are looking like they're 26.
Bite your lips for me. Sorry.
It's okay. He's getting me, folks.
Okay, take a break.
All right, so at this point, I forgot to turn on the machine to show you the rest. But right here, I'm showing you what I looked like the morning after. You see, I am swollen underneath. My right side, there isn't that much damage, but my left side showed a lot. And now you already see the speckling. Day 2, my swelling under the eyes was a lot. My right side still looked pretty good. I did have some speckling, but my left side was seriously targeted, which was very important. In the morning of day 3, my swelling was even more under my eyes, more of the bruising. The pigmentation on the right wasn't so bad, but on the left, you can see that it is definitely, she definitely got it. So you can see by day 4 evening, the swelling is gone from my eyes. The right side looks great, except for that little pimple there at the bottom. And my left side is still healing, although it does look much better. So this is day 5. My dark circles are just there because they just are. The right side of my skin looks great, healing perfectly. And the left side, if you can see, is nice and clear at this point. Thanks again for watching, and I'll see you soon. Thanks. Bye.